Hello friends, and welcome to the third chapter in the trilogy, The Peristaltic Motion Secrets to Sickness and Health. As I mentioned in the previous chapter, because of my congenital heart disease, I had prior knowledge about the influence of Valsalva maneuvers on blood vessels. Now science identifies one reason for hemorrhoids and appendicitis, straining during defecation. Yet, can this action that causes blood vessels around the hemorrhoids to bleed, to be infected and inflamed, also influence other blood vessels the same way? To answer this question, I had to trace the source of the vessels around the hemorrhoids. As you can see, the portal vein is connected to the entire digestive system, including the liver, pancreas, spleen, and kidneys. Though we can see and feel swollen, painful hemorrhoids, we cannot see the internal small blood vessels elsewhere, right? What led me to my discovery was the fact that Valsalva maneuvers causes a sudden and sharp change in blood pressure. Let's see how it's done. The maneuver is divided into 4 phases. In phase 1, blowing air against closed airways causes the pressure in your chest to increase. That's because the pressure in your aorta inside your chest briefly increases, and blood is forced out of your heart to the limbs and the rest of your body. As you can see, the first phase causes a temporary spike in your blood pressure. From that blood rush, the face turns red and blood vessels swell. The second phase causes a steady drop in blood pressure as a limited amount of blood in the veins returns to the heart. This lower amount of blood returning to the heart results in less blood pumped from the heart and a fall in blood pressure. Sensors respond to this pressure drop by increasing your heart rate and output and contracting your arteries. In the third phase, you're relaxed and your blood pressure falls for a few moments. The fourth phase starts when you release the pressure. Then the blood starts rushing back to the heart. In response to that, your blood pressure will rise. That's because your blood vessels are still constricted. Problems start when weakened small blood vessels don't hold the sudden pressure spike and they can erupt. If that happens, blood clots form to block the leakage. That's a normal process. However, when using the maneuver frequently and if the weakened vessels continue to erupt, then more blood clots are produced. This ongoing irritation causes inflammation and infection. Besides that, when there are more blood clots in the bloodstream, the risk of having a heart attack, stroke, liver, pancreas, and spleen diseases increases. The ongoing pressure in the portal vein causes portal hypertension, which leads to bleeding veins. Esophageal variceal bleeding is probably the most known disease related to portal hypertension. That's because physicians have easy access to the esophagus to see the bleeding veins. But what about all the other organs that are directly connected to the portal vein? The liver, pancreas, spleen, and kidneys. How are they affected by the ongoing internal pressure that causes bleeding, infection, inflammation, and blood clots? Science tells us that blood clots can be caused by anything that prevents your blood from circulating normally or clotting properly. As I demonstrated before, the Valsalva maneuver causes an abnormal interruption in blood flow. Science also found that portal hypertension increases the pressure within the portal vein. It's often due to scarring of the liver or cirrhosis. Increased pressure in the portal vein causes blood to be pushed away from the liver to smaller blood vessels, which are not able to handle the increased blood pressure. This leads to the development of large swollen veins within the esophagus, stomach, rectum, and around the belly button. Over time, varices gets fragile and can erupt easily. All this can lead to infection, inflammation, and the formation of chronic disease in the stomach, esophagus, and rectum. But that's not all. As you can see, Valsalva maneuver creates opposite pressure on the diaphragm, pushing the diaphragm downwards towards the esophageal sphincter. Then an opposite pressure comes from the gut upwards. Over time, the opening in the diaphragm weakens and reflux disease takes place. In my research, I found that when chronically using Valsalva maneuver, the risk to develop chronic disease in the intestinal tract increases. Furthermore, I realized that the pressure many people apply during defecation increases the risk to develop diseases in places that are not directly related to the digestive system. In upcoming posts, I will talk about each disease separately, but for now, I want you to be aware of them. So, in men, this pressure causes prostate problems and low sperm count. In women, the pelvic floor is different than in men. That's why women develop more diseases there. Women were never informed about the connection between menopause, pelvic floor prolapse, and the pressure applied during defecation. This pressure can cause retinopathy and glaucoma in the eyes. It can cause venous and deep vein thrombosis, which usually results in varicose veins affecting mostly women. And the list goes on. How does all this happen to us? This happens many years ago when the invention of the toilet considered an innovation in personal hygiene. This new posture was ergonomically disaster, and new diseases started to emerge. These diseases were almost exclusively confined to people where they adopted toilets. Since then, diseases like appendicitis, colon cancer, prostate problem, diverticulosis, bladder infection, pelvic floor prolapse, inflammatory bowel disease, and liver diseases were on the rise. Science has tried to blame the refined diet for the increasing incidence of digestive diseases. Their attempt to prove that nutrition has a significant factor have consistently failed. After I summarized the articles published by Science regarding intestinal diseases, I came to the following conclusion. Diseases in the intestines are common in countries using the modern toilet. Science doesn't know what's the underlying reasons for those diseases. Science doesn't search why people in developing countries where they still squat for defecation, diseases of the bowels are not as common. Until today, there isn't a solution to the mystery, and intestinal diseases are on the rise. Medicine and surgeries tend to make the situation even worse. You see, almost every disease in the bowels has an anatomical denominator, which I previously explained. The modern toilet causes enormous unnecessary suffering and an annual waste of billions of dollars in treatment expenses. The time has come for us to return to our natural way of defecation and put the end to this unfortunate situation. Like in many other cases, here too, science is ignoring the fact that wrong posture might be the underlying cause of many diseases. Their unwillingness to inform the public is due to conflict of economic interests. The public will continue to be lost in the dark, and future generations will continue to be trained to defecate while sitting on the toilet. The freedom to choose and act is in your hands. Use it now wisely. Goodbye.